Why you should never drink soda, and 5 foods you shouldn't eat. When we're dehydrated, it's easy to reach for a nice cold soda that's full of sugar, caffeine, sweeteners, and lots of calories. It is refreshing and thirst-quenching, but does it do any positive benefits for the body? We had the pleasure of speaking with Dr. James Gerber, Associate Professor of Clinical Sciences at Western States Chiropractic College, WSCC, in Portland, Oregon. He is at the University of Bridgeport Nutrition Institute and adjunct faculty at State University, College of Naturopathic Medicine regarding soft drinks. Before we start this video, don't forget to subscribe to our channel for more daily tips like this and turn on your notifications so you don't miss any of our new videos. Well, now to the interview. Our first question we asked Dr. Gerber was what he thought soda was the biggest danger to the body. He replied, "The biggest danger is calories. Meatballs are a major part of the obesity epidemic." Dr. Gerber would be right in his hypothesis. According to a 20-year study published in Dietary men and women who increased their consumption of sugary drinks by 1 12-ounce serving per day gained weight over time. 120,877 American men and women who were free of chronic disease and obesity between 1986 and 2006 were evaluated for the study. Each participant was assessed for lifestyle factors and weight change every 4 years. The results showed that every 4 years, participants gained an average of 3.35 pounds, and sugar-sweetened beverages contributed to an average weight gain of 1 pound. We mentioned this study to Dr. Gerber and asked him what weight and soda have in common. He mentioned, "It's easy to overestimate liquid calories with solid foods." When he mentioned this, we wondered if there could be other downsides to drinking soda. According to Dr. Rochelle Lee, ROSIN, there may be a link between brittle bones and soft drinks. CLEVLNDCLINIC reports. Dr. Rojan explains that one reason for this may be that most soft drinks contain phosphoric acid, which has the ability to leach calcium from our bones. Caffeine from these drinks has also been linked to osteoporosis. However, there is still not enough evidence to make a definitive statement about this. Many reviews and studies come from FRA and GHMOSTOPROSISRESERCHBND. In one assessment from 2006, 1,413 women and 1,125 men were analyzed. The researchers found that soda consumption significantly lowered women's BMD. Additionally, LINDAK, ASSEY, PhD, RD, Professor of Human Nutrition at Washington State University, told WebMD, excess phosphorus promotes calcium removal from the body when calcium intake is low. After discussing this study, we asked Dr. Gerber what amount of soda he would recommend for someone who consumes highly caffeinated soft drinks. He replied, "I would advise them to drink 0, but if it becomes a habit, I would say 8 ounces is fine if supported by a healthy diet." One of the reasons Dr. Gerber said 0 is a study published in the AMERICNJOURAL, OFCLINICL, and UTRITION. The study followed the health of approximately 90,000 women over 2 decades. Researchers found that women who drank 2 servings of sugary drinks a day had a 40% higher risk of having a heart attack or dying from heart disease than women who rarely drank sugary drinks. Is it because you don't want to drink soda? Keep watching as we explore some other foods you should avoid if you want to maintain a healthy diet in our conversation with Dr. Gerber. Another reason Dr. Gerber was against caffeinated sugary drinks is diabetes. A study published in the journal JAMA sought to find out if there is a relationship between the two. So the researchers conducted a cohort analysis among women who participated in the Nurses' Health Study between 1991 and 1999. The diabetes analysis included more than 91,000 women who did not have diabetes or other chronic conditions in 1991. The results showed that women with stable sugar-sweetened beverage intake did not experience weight gain over 4 years, but did gain weight. Was highest among women who increased their consumption of sugar-sweetened soft drinks from 1 or at least a week to 1 or more a day. Those who want to stop drinking soda and cut it out of their diet may want to replace it with water. RRDSCHOOOFPBLICHGLTH states that water helps restore fluids lost through respiration, metabolism, sweating, and elimination of waste products. It not only quenches your thirst, but also hydrates your body and reduces the risk of fatigue. The Institute of Medicine says that adequate daily water intake is 125 ounces, 15 cups for men, and 91 ounces, 11 cups for women. Okay, now that we've officially weaned you off soda, what other foods are unhealthy? What should be avoided to maintain a healthy lifestyle? Let's dive right in. Warning: some of these answers may surprise you. 1. Whole wheat bread. We are sure you have many questions. Namely, how is that possible? Eating whole grain bread is an example of what you should be eating to lose weight and maintain a healthy diet. Well, that may not be true. According to MAIOCIC, although whole grains usually contain whole grains, most products contain refined grains. What are refined grains, you ask? These are grains that are found almost entirely in bread, the worst and most unhealthy type of bread. What can we do to make sure we are eating the right whole grain bread? Just check the labels. Don't listen to the words on the front. USCLE-FITDSS recommends that you look for whole grain or whole grain as one of the first ingredients to a couscous. You can always add phonetics like kun. For these two next, couscous just sounds like a word. Couscous. Couscous. It even sounds good for weight loss and a healthy lifestyle. But like whole grain bread, it's just a marketing ploy. Again, like whole grain bread, couscous is just a bunch of processed grains, which, as we have already said, is not at all useful for weight loss. Wait, before we go any further, we should tell you about some grains that are really good for you. BTTRAGLTH says real whole grains like bulgur or quinoa are great for filling your belly and keeping you slim. However, always remember to check the level 3. Road mix. How can this backpacker be sick? People literally climb mountains to eat this stuff. Apparently, it is not as healthy as mountain climbers and nature lovers once boasted. Thank you very much, Tenzing Norgay. Anyway, it's really a mix of store-bought tracks that you need to watch out for. Things like dried bananas have added sweetness, and some chips can be high in sodium, deep-fried, or blow your calorie count. In fact, USCLEFITNESS says that dried fruit should be avoided in general. They report that we should think of dried fruit as a fiber candy because it is high in sugar and calories. Wait, what do we do when we want a snack on our next outing? First, RERSDIGEST says, make your own mix at home, don't buy at the store. Least then you can control what actually goes into your ambient air mix. They also recommend an emphasis on nuts and seeds. If you need something sweet in there, a little dried fruit or dark chocolate never hurt anyone. For smoothies. We hear you scream. NOOTHIE. The poster child for healthy living is sick. Well, you are partially right. A lot depends on whether you make smoothies at home and what ingredients you use. Store-bought smoothies are out the window. They often contain unhealthy sugars and unnecessary calories, even though they are again considered healthy. Some stores even add ice cream or sherbet to their purportedly healthy smoothies, which we all know are killer for the waistline. When it comes to homemade smoothies, CHEATHET says you should only use a combination of fruits and ingredients with no added sugar. When it comes to milk in your smoothie, it depends on your diet. What can we take away from today's video? 3 important lessons. 1. Stay away from soda. It's unhealthy, has too many calories, and will ruin your diet. 2. Always read the label. Although something may advertise itself as whole grain, it may just be a gimmick. You don't want to eat refined grains when you're trying to cut calories. And finally, 3. Try not to get store-bought health products. Most cases, they are worse for you than products you can make in the comfort of your own home. Plus, you'll save money by avoiding purchased products. And that's it. What do you think? Have you given up soda completely because of our video? Let us know what you think about soda and how you plan to handle it going forward in the comments section below.